Federal Health Minister, Dr Blewett, has got involved in the issue of the controversial and deadly disease AIDS, criticising the Medical Journal of Australia for scaremongering. Dr Blewett was referring to the June the 11th issue of the MJA, which carries a picture of a cloak and skull, a chest x-ray, and the newspaper headlines, "The Black Plague of the 80s, and perhaps we've needed a situation like this to show us what we've known all along, depravity kills." But the journal's acting editor, Cathy King, told me this morning that the intention of the issue was precisely opposite to the way that Dr Blewett had interpreted it. Has the MJA suddenly gone sensationalistic?
Not at all. The chest x-ray was taken from a patient. The other three illustrations there, the two headlines and the skull and cloak, were in fact taken from newspapers, all published within about the first 4 months of this year, and in connection with articles on AIDS. The Black Plague of the 80s and the illustration were taken from the Australian, and the perhaps most sensationalistic headline of them all, the one finishing up on "Depravity Kills," comes from one of the Sydney evening papers.
So you were making a point about the press, were you?
Well, we were hoping to. The press coverage of AIDS has been very, very hysterical, and we were hoping to show to people that Wishmakers agreed to do a send-up of it. The cover lines did indicate this, but I think perhaps a lot of people haven't read as far as the cover lines.
Are you surprised that Dr Blewett reacted in this way?
I'm very surprised, particularly in the way he worded the statement, which seems to attack the entire contents of that issue, which included a number of scientific papers and a leading article on it. It's also a bit strange to me that it should have taken him 2.5 weeks to attack the issue, because this is not our current issue anymore.
What do you think the newspaper coverage is doing to the whole AIDS issue? Do you think it's overly scaring people?
I think it is scaremongering. I think people get very worried when they read about AIDS and an epidemic, and they feel it might be able just to contact it from shaking somebody's hand and this sort of thing. And this is totally untrue. And I think the newspapers can sometimes play up what it is, a serious disease, but I think they are overplaying it.
There's always been this sort of mythology that you can catch all kinds of venereal diseases from other people's towels and from lavatory seats and so on. Do you think it's an extension of that?
I'm sure it is, but you've used exactly the correct word, mythology. That's what it is. You can't do it.
Well, do we actually know enough about AIDS to say that? There have been rumours or reports that it can be transmitted by the body's sweat. Is that possible?
It is possible. We would hope that we understand a little bit about its epidemiology, even if we don't understand what actually causes it yet. There are many parallels with a virus called hepatitis B, which can be transmitted in body secretions. But we would have to go a long... We're pretty sure it can be the AIDS virus, if that's what it is, can be transmitted by blood. But it's a long way to saying it can be transmitted by the body secretions.
How much of a problem is it? Are people over-exaggerating even the numbers involved?
Oh, grossly. There has been one case in Sydney that has been fully recognised by CDC as being a case of AIDS. I believe there may be a case in Melbourne. There are about 5 cases in the country which have the prodromal syndrome. That is, they have some of the immune deficiencies without having the serious infections. And that's it at the moment. We've got no grounds whatsoever for saying that there isn't any kind of epidemic in this country at all.
Do you think that even some members of the medical profession may be exaggerating the problem?
I think that people are trying to be perhaps over-cautious. It's possible that some doctors, when a patient comes to them and he knows that and the doctor knows that the patient is a practicing homosexual, and the patient may have some symptoms that the doctor can't quite put together, is saying, well, we'll have to rule out AIDS. It doesn't necessarily mean the patient has AIDS. In fact, it probably means he doesn't. It's difficult to know, because obviously if there is all this sensationalistic publicity, and there's a lot of papers written about it, and the American literature is full of it, and it's obviously read here, but doctors are also impressed by what they read as well as the general public.
Can you blame people, though, for getting in a panic, particularly in the gay community?
I don't think you can blame them for worrying about it at all, no. I think it's a very realistic fear. But we have no evidence as yet in this country that it really is a serious problem.
Of course, we don't actually want to get to the stage where we do have the
Agreed.
evidence.
Very much
Isn't
agreed.
it best to panic before rather than after the event?
Well, the panic sometimes produces irrational results. In the sort of the services start getting swamped by people, you know, who could say they've got a cold or a cough or something. Could this be AIDS? And we don't want to overload what at the moment is a very small service.
Dr Cathy King of the MJA, the Medical Journal of Australia. In our Canberra studio now is Dr Neal Blewett, the Federal Health Minister. Dr Blewett, had you read the whole of the MJA when you made this criticism?
I'd read the whole of the MJA, and if Miss King had read my statement, she would have seen that I referred to it in only one sentence, or something like 25 sentences. I was not attacking, that wasn't the major purpose of my comments. And in fact, I noted, and I just note the only quote I made about it, he said that he was particularly disappointed that the June 11th, 1983 Journal of the Australian Medical Association appeared to further this prejudiced and sensational approach.
Are you satisfied now that that wasn't the intention, at any rate?
I'm certainly satisfied it was not the intention. I think in many ways the articles in the journal, all of which I've read, are extremely impressive pieces of work on AIDS in general and the problem in Australia. And the articles contribute, I think, very much to the reasonable discussion about this problem that I've been arguing for in the rest of the press release. I do think it would have helped the point she was trying to make if those sensational headlines on the front cover had in fact been identified as clearly as newspaper quotes. You have to turn into, I think, about the third page and you discover that.
Well, so what is the federal government doing about AIDS, or is there anything that you can do in terms of funding or administration?
Well, there are a number of things we can do, but the first thing I think is important is, as Dr King said, simply to get the problem in perspective. There have only been 2 confirmed cases in Australia at the moment, and there are some 5 suspected cases. Now, that is not the kind of epidemic, the kind of massive problem, health problem, that is being suggested by some of the sensational, alarmist, and in many cases quite moralistic headlines. So the first thing is, let's get a proper perspective on the problem. Nevertheless, we have taken actions. A number of the states have already moved to make AIDS a notifiable disease, and that will help with identification, picking up the problem, tracing contacts and things like that. That's the first action. Secondly, there is general advice now that people in the endangered groups, particularly, for instance, male homosexuals with many partners, it would be prudent for them not to donate blood because of the possibilities that might be a source of infection. And the National Health and Medical Research Council is set up a program to monitor the disease, to keep in close contact with the Atlanta Center, which is the one center in the United States which has become the collecting center for all information about AIDS, and to support any research that's necessary here in Australia. The great problem with AIDS is, of course, that, first of all, there are signs that it may be the result of an infectious agent, possibly even a virus, but that just hasn't been determined yet. That hasn't been identified.
Because it's one of the, I suppose, glamour diseases in the medical profession, and there's lots and lots of research going into it in America at the moment. Do you think that we should stand aside in that field in terms of the research into trying to find a cure for it? Is it something like the cure for cancer, which is just going to take more resources than a country like Australia has?
Well, I think there no doubt can be small contributions made by Australia, but of course on the whole we just don't have, luckily, the cases here that give us a base to do very much effective work, and I hope, one hopes that we don't reach that stage.
Would you think of perhaps more funds into the area of immunology?
Well, immunology is the most important aspect here, and in fact some of the general research on immunology may well relate to this particular deficiency. Again, it's interesting, though tragic, that there may well be some important cancer breakthroughs as a result of AIDS, because one of the results of AIDS, there are 2 major types of disease that flow from the breakdown of the immune deficiency system resulting from AIDS. One are forms of cancer, particularly this very rare, or what had been a very rare cancer, Kaposi's sarcoma. And it may well be that we're going to learn some very important things about cancer as a result of AIDS. Now, tragically, that this has had to happen, but we may have some very great benefits for cancer research there. And then secondly, of course, the immune deficiency breaks down and leaves people open to a whole range of what we call opportunistic diseases, such as pneumonia, meningitis, hepatitis, those types of diseases.
Dr. Blewett, thanks very much.
Thank you.
The science show, Robin Williams' science show at 20 to 1 on Saturday, will be running an item by Kirsten Garrett, recorded in San Francisco, I believe, on AIDS, for those who are further interested in the issue.